How are you?
Good, thank you. How are you doing?
I'm okay. Okay.
Thank you so much for having
me.
me.
Okay. So if you could just introduce yourself to my viewers. So I know how fantastic you are, and I've been so excited to bring you to everybody. But if you can let everybody know what you're all about and what we're doing here today.
Sure. So my name is Farrah. My background is in dentistry, and for the last 4 years, I've been focusing on facial aesthetics. So I have a clinic which is focusing on Botox, fillers, and also medical grade skincare. So that's sort of my bread and butter and has been for the last 4 years. So I'm really excited to help and give you some tips on what you can do to kind of look after your skin.
How do you jump from dentistry to all the rest? And how do you manage like Monday we'll do your teeth and Tuesday come and get your
Yeah, so actually, the way I got into it initially was I was doing a year working in a hospital in oral and maxillofacial surgery. So we dealt with like surgeries of the face and also in A&E if anybody came in with a facial injury. So that was kind of the first time that I actually used needles on the face and, you know, got to work in the face rather than just in the mouth. And that's how I got introduced to the idea. So then I went to study more about it, did some courses, and then I just enjoyed it so much that I actually started to do more aesthetics and less dentistry. And about a year and a half ago, I actually stopped doing dentistry completely. So now I'm solely facial aesthetics.
Amazing, fantastic. Okay, so what introduced you?
Yeah, so I just enjoy it so much more. So it's nice to be able to, you know, pursue what you actually enjoy doing. So definitely a good decision.
Yeah, absolutely. What introduced us and connected us was the ZO range, which we're going to be discussing a bit today. Because I've just found out about it and I'm totally in love with it. And I have a few of their products and I'm already noticing it's not even been a whole week since I started, and it's just, I've seen such a difference. My pores have shrunk already. I am so amazed at how, and I'm not even using any of the harsher, I'm just using all the gentle products. So I'm not using any retinol or anything like that, which I am about to introduce very carefully. I am so scared.
Yeah, absolutely. No, I'm very excited to, you know, to actually get you started on doing some more active, but definitely the way to go, it's best to start off slow, get yourself used to products, because with medical grade skincare, it's very normal at the beginning to get some reactions. It's quite different and they're a lot stronger than many products that, you know, people may have used just over the counter. So it's okay if you get a reaction, doesn't mean you're allergic to it. You just need to give it a little bit of time. Once you've settled into that, then you can start adding in, you know, the more potent stuff, which is going to really help you to transform your skin.
I'm scared. Right, okay, should we just jump
No, you'll be fine.
We'll jump straight into the questions that I've had from everybody, because I am so sure. We're really limited on time, aren't we? And the hour will just fly by. So I want to make sure that we get all our questions answered. So the first one, so we'll do it like an interview style. I'll ask and you can just answer the first question.
Absolutely.
With brides, it's always a really, really big thing. Most of my brides do have trials. And we always discuss the skin at length, because ultimately it's about how much makeup you pack on and how skilled your artist is. Unless you are you know, you have to have a good base. The better your base is, the better the makeup is going to look. That's just
absolutely.
And if you have a really bad base, you know, if your artist is skilled, which I do have sort of quite a lot of experience with sort of pigmentation and scarring, and, you know, how to sort of level the skin out, and that's great. But ultimately we want to make sure that we're feeling confident without having to put the makeup on. And when you go on your honeymoon, you know, and especially if you're going for a beach destination or whatever, you don't want to, you know, have so much makeup on. You want to just be able to relax and still feel great. So the first question is, what products should brides have in their skincare routine? What should a typical skincare routine entail? So leading up to your big day, or for everyone really? What should you?
Yeah, fine. So I would say the first thing is that it's really important to get an individualized plan for you, because with skincare, it's never going to be one size fits all. So it really depends on your individual concerns. However, there are, in general, 5 sort of steps that pretty much everybody should do. So that's a cleanser, and that's something you need to be doing morning and night. And I know that sometimes it's difficult either in the morning or at night. People are rushed one or the other. So sometimes they skip that out, but it's really important.
You should do a double cleanse. So cleanse your makeup off and wash your face again, ladies. Okay, so I think a lot of people...
Exactly. And as much as possible, avoid using sort of like makeup wipes, because there's a lot of not very good chemicals in there which aren't great for your skin. So if you can use like a good cleanser, that's the ideal. And the second thing is exfoliating. Third thing is tone. Fourth is moisturize, and the fifth one is SPF. So those are your 5 things that you kind of want to have in every skincare routine. Those are the basics. Then, depending on your skincare concerns, you can add in things that are going to actually help to target your specific concerns. But I would say, you know, if you're planning your wedding, try to start your skincare routine as early as possible. I mentioned already you may get some reaction, but also it's going to take a little bit of time, you know, to get your skin at its best. So the earlier you start, the better for your skin.
Are the sort of medical grade products suitable for everybody? Can everybody be introduced, or is there any sort of obvious, maybe for diabetic or anything like that? What restrictions are there?
Yeah, so they're quite good. So in general, you know, depending, you can definitely tailor to most people, and you can, you know, choose softer you know, products for certain people. But for example, if you're pregnant, breastfeeding, then you don't want to be using it. And you do need to be careful. For example, if you've got some quite severe skin conditions, it may be that actually they'll be too harsh for your skin. So for example, like eczema, psoriasis, those are the types of skin conditions where your skin is very, very fragile. So in conditions like that, we want to be a little bit careful, but it's quite good because there's a huge range of products. So we can pretty much always find something for everybody, apart from the pregnant and breastfeeding, pretty much.
Okay, we've got a little question here, and I'm just worried if I don't catch them as we go along,
Sure.
we're going to miss them. So Jahida TS Life says, with acne prone skin, the spots are kind of underneath the skin and not on the surface of the skin. Please explain how to best tackle those spots which are underneath the skin. That's a really good question.
Yeah, so it's a really good question. Yeah, so the most important thing to understand about acne is why the spots are forming. So for most people, really it's to do with the oil control. So there is basically too much oil being produced. So if we take it back to basics and we find a way to control the oil, to reduce the levels of oil being produced by your skin, it will in turn reduce the number of spots that you're getting. That's kind of the thing you want to aim to do. When the spots are sort of under the surface and they haven't come out yet, yes, it can be hard to target them. And in some cases, you know, using really good skincare can actually stop them from becoming worse. But then once they are there, we can also continue to use things to actually tackle them. But if we try and do a more long-term approach and actually try and target the oil and reduce it, that's the best thing we can really do to treat acne.
I have got to mention though, because I have, like I said, it's just been a week since I started the ZO range, and you want to quickly explain what the ZO range and Zainab Aji, who he is?
Yeah.
Can I do that quickly, and then
sure.
Otherwise people might not know what I'm talking about.
Absolutely. So the ZO Skin Health range is a medical grade skincare range which has been developed by Dr. Zainab Aji, who's a very famous dermatologist in California. So the idea around the products is there's a huge range. So they tackle certain things. So for example, they have a range for acne, they have a range for pigmentation, and what you can do is, for example, I underwent training to understand all the science behind the products, and then exactly what the products do and how you can use them in combination with each other to actually create a bespoke plan per person. It's so fascinating. It's literally like another world.
It's making me so excited.
Yeah, it's literally like another world. So it's important that you know. Yeah, it's important that you know that they are stronger products and they do require a consultation first to decide which products are right for you. But yes, you will definitely see results compared with, you know, products that you can just buy, you know, over the counter.
That part was scary. I mean, when I was doing the sort of consultation process and things, I was thinking, oh my God, you know, what's going to happen? Is my face going to like melt? But it's been so good. And I did start with baby steps because my skin just reacts to everything. Everything makes it a flare up. And what I wanted to say was, with regard to that question, when you're talking about the spots under the skin, this is called the complexion renewal pads. The complexion renewal pads.
Yeah.
And they are amazing. So if you have even anything under the skin and you can't, it's not even showing, no whitehead, no nothing. If you put it on top, it like shrinks. It is incredible. So guys, I can't stress enough. I think I'm on 5 or 6, and I have been so blown away. And this is not a paid advertisement. There is no, you know, we have no affiliation, or I don't have any affiliation with any of these products. So, you know, it's nothing like that. I really just want to, I really wanted to share with you how amazing it's been, because I have always suffered. And the reason I got into makeup was because of my skin issues. And I think a lot of makeup artists get into makeup because of skin problems. Okay, so
Definitely.
okay, shall we go to the next question? This is a really good one, really popular one. How often should you exfoliate, and should everybody exfoliate?
Yeah, so you need to be careful because there's a fine line between not exfoliating enough and over exfoliating. So the general rule of thumb, I would say, is to exfoliate 2 to 3 times a week, but also listen to your skin. So the idea behind exfoliating is your skin works in a cycle, which usually is 6 weeks. So what happens is the skin cells die and then new ones form. But the dead skin cells can actually sit on the surface of the skin, and it can make your skin feel rough. It can make it look dull. If you're exfoliating, what you're doing is you're basically using something which is a little bit rough to take away all those dead skin cells, and then you're exposing the brand new skin underneath. So it will really help your skin to glow, and it will help to keep it in that cycle. So I would say 2 to 3 times a week. And pretty much everybody, apart from those with very, very sensitive skin, as I mentioned, like eczema, psoriasis, they need to be a little bit more careful. Otherwise, most people should definitely be exfoliating 2 to 3 times a week.
With the ZO system, are you supposed to be working towards doing it more than 2 or 3 times, or not?
No, so with exfoliating, even if your skin can handle it, you still don't want to do it more than 3 times a week, because that can actually harm. You can over exfoliate. So, you know, initially, yes, you'll get a reaction, but even once you're not getting any reaction, that's fine. Still only continue to do it 3 times a week.
Okay, great. Okay, let's see. How has anybody got any other questions? What products can you recommend to tackle the oil? Did you hear that? What products?
Yeah, it was what product can you recommend to tackle the oil? Yeah, so as we were saying, for example, with the, is it working? Oh, I'm frozen a bit on here.
I think you're am I frozen? Your screen is freezing.
You're not, but I seem to be frozen for some reason. Maybe.
I can hear you. Guys, can you hear us?
Okay.
Send me some hearts if you can hear.
Let's see. If it doesn't resolve, then I may come out and rejoin. Shall I do that? Yeah. Let me just do that. I'll come back and rejoin.
Okay, sorry about that, guys. Technical issues. She's just going to come back. Thank you for joining me today. Hey, I'm so glad you can hear. How is everyone doing? You guys okay? Are you guys enjoying it? Please keep your questions coming if you have any questions. Farrah is so good. Oh, here we go. She's coming back now. Go live. It's usually my internet.
Perfect. So hopefully that's better. Sorry about.
It's usually my internet that goes.
I don't know. It might be mine because I froze. Sorry. So the question we were answering was what products do you recommend to tackle oil control? So with the ZO range, as I was saying, they have products which are specifically made, for example, for acne. And those are the products that are really going to help to tackle oil control. So the first thing is using a cleanser. So they have a cleanser which has an ingredient called salicylic acid. And that's something that's really important to help control your oil. The exfoliating polish.
Gentle cleanser, or is that the exfoliating cleanser? Because
that's the exfoliating cleanser. Yeah, so the gentle cleanser is a lot more gentle, as the name suggests. So it's really good if you have sensitive skin. However, if your concern is to tackle oil, I would definitely recommend the exfoliating cleanser. You then have the exfoliating polish, which you did mention, which is the blue crystals. That also helps. Well, yeah, you can show us. So that also helps with oil control.
Popping it, as you can see.
It's really, really amazing. It makes your skin, as we said, like...
Calm down on it, actually, now that you... maybe I was using it a bit too much. But I'm like, oh, polish my skin. It feels so good. I can't tell you guys. It's so amazing.
It does. And it also makes you feel like you're definitely doing something because of how it feels. Yeah. So you definitely, I totally understand what you mean. Then the final thing, which is really important for the oil control, is the little pads that you showed us as well. So the pads that you showed us are the complexion renewal pads, but you can actually also get a stronger version of those pads if you suffer from quite severe acne. So depending, as we said, on your skin, we can tailor. So yeah, it's literally those pads, and they're amazing to help with oil control.
I was worried they're going to dry out, but they're quite wet, aren't they?
They are, definitely. So it definitely, yeah, like there's definitely enough liquid to cater for all of the pads, for sure. So it shouldn't dry up.
Okay, and the next question. Have we got any other questions on here? I think everybody is just watching. We must be doing such a great job. Right, okay. Do you need different products for morning and evening? That's a good question.
Yeah, that's a great question. So, yes. So, we mentioned
just once a day. If you're really busy, like a lot of brides,
yes,
so much going on, they're just exhausted.
Definitely, like obviously, we need to be realistic for sure. As long as you're doing it once a day, that's obviously better than not doing it at all. But there are some products which you can only use in the morning and only use at night. So an example is an SPF, which is to protect your skin against the sun. There's no benefit of using that before you go to bed. That's not really going to achieve much. And similarly with a vitamin C serum, you'll get the most benefit if you're using it in the morning, because it has an added protection against sun damage as well. So ideally, those two products are only morning. And similarly with retinol serum,
SPF is not.
You don't need to use it in the evening. No, you don't need to use it because it's protecting your skin against the sun, and there's obviously no sun. The important thing, to know is that an SPF will protect your skin even when you're not in bright sunlight. Even if you're inside, some of the UV rays can come through the window. So it's important to do it every morning, regardless of whether you're going out or not, but you don't need to use it before you go to bed. However, retinol serum, for example, makes your skin sensitive to the sun, so you cannot use it in the morning. You must only use it at night.
Oh, I see. So which serum is that?
The retinol. So you haven't started that yet. So that's like our next step. But the retinol serum is something you need to be, it's amazing, like it has amazing results. However, you need to be a little bit careful because it makes your skin sensitive to the sun.
So you still use the SPF in the morning alongside the retinol, and then you use as well?
So in the morning, you're basically going to be doing your fundamental, your cleansing, exfoliating, toning, and then you want to use your SPF, your vitamin C. Those are the two main things you want to add in the morning. And then at night, you don't use either of those, and you just use a retinol serum instead.
Okay, great. Perfect. Gosh. I need to write it all down. I have written it all down. I just follow it religiously.
No, what I always do is whenever I do a skin consultation and make somebody a skincare regime, I write everything down, what products to use in the morning, what products to use at night, and they always have it as reference because it's easy to forget. But once you get into the routine, you'll know what to do.
This is the issue, because I wasn't actually introduced to the range by Farrah. I was introduced by somebody else. So this is why obviously. It wasn't maybe a very good job. But now I have learnt better, and I should be only coming to you. Let's have a look. A lot of clients suffer with acne, especially last minute stress breakouts. I have had brides on the day, which I may have been, you know, I may have first done their makeup on their prom, you know, 5, 6, maybe 10 years later on their wedding day. They've never ever had bad skin, and on their wedding day they have huge, like, breakouts because of stress. What are there any last minute quick fixes that really work, such as these pads?
So the first thing to mention before we go into the last minute fix really is, if you get it under control from beforehand and the oil control, you know, is really top notch, it will honestly really reduce the risk, even if you're stressed, of the, you know, getting last minute breakouts. Even then, of course, in that environment, obviously you're very stressed, so you may still get it. So you can get basically a medicated ointment, and it's something which is called benzoyl peroxide. It's quite strong, and it basically dries up the spots. It still can take, you know, a couple of days to really remove it, but that's kind of the quickest.
Do you need to go to a GP for that, or would one go to you?
Yeah, so in the ZO range, for example, they do actually have a benzoyl peroxide ointment, which needs to be prescribed to you, and that works really well. So that's kind of the thing that I would suggest to kind of keep. If you know that you already suffer from breakouts from acne, then definitely keep that, you know, as your little saving grace when you get closer to the wedding. But then also just be careful. Like, the thing is, with a lot of Asian weddings, there's lots of events, so you're wearing heavy makeup for more than one day. So by the time you get to the main event, you know, your skin might be worse than it was before. So it's really important to make sure you're taking off your makeup properly after each event. Obviously you come home, you're tired, you just want to go to bed, but it's really important to make sure you really cleanse your face. Like we said, double cleanse, and to get rid of all the makeup before going to bed. Make sure you're cleaning your makeup brushes even more than you normally would, for example, if you are doing your own makeup for you know, any
around the lashes and things as well. So many times I will come the following day or even 2 days later and I still see lash glue stuck. You know, girls, get it off. It's, you know, you don't want to risk infection, all sorts of nastiness. So it's really important to get that face clean. But yeah,
so it's an interesting question for you actually. What do you recommend to remove lash glue?
Well, you can have, to be honest, the eye makeup remover is the best thing, and you just use a Q-tip and just dip it in and just gently, I would just twist against, I mean, it's like a little twisting motion with your finger, and just hold your lash maybe like that. The skin here, just pull your skin here, close your eye, and just along the lash, get really close. Not so that it's dripping, because you don't want it to go in your eyes, but it is gentle enough to use. Yeah.
Yeah,
so
perfect. That sounds good.
You know. But ultimately, if you don't put your glass, if you don't, it should, you know, it should come off. It should come off. Hi guys, it's so nice to see so many of you with us. Should I go to the next question? Okay. Oh, okay. So many clients have deep scarring or pigmentation. Are they problems that can be treated together or attacked separately? And what is the best solution for it? So often you can have teen scarring from like teen acne, and it just left lots of marks, especially this area here, which you probably see all the time, all around here. Being women, if it's to do with your sort of hormonal situations, hormonal imbalance would be sort of really strong here. What do you recommend for the scarring? And if it is lumpy, is there anything that they can do before?
Yeah, so it's really important to determine what's caused the scarring. So we'll kind of start with acne scarring first of all, because that's one of the most common things. So if you just have sort of discoloration from the acne scarring, but it's not an actual sort of like a crater, it's much easier to treat. So, you know, for that we can use at-home skincare, using a vitamin C serum in the morning, using the retinol serum at night, along with, you know, the normal skincare routine. That will work. You will see a huge difference in reducing.
Yeah.
It definitely will. The thing with retinol is when you start using a retinol serum, it's normal to peel. You should peel, because what's happening is it's kind of getting rid of that layer of the skin and you're exposing the next layer. So to get the best and clearest result of your skin, what you want to do is you start off, for example, at like a 0.25%. Once the peeling stops, then you move to 0.5. Once the peeling stops, you move to 1. So that way, you're trying as much as possible to get the clearest skin you can.
So what about jumping straight into 1? Because while lockdown is still around, I am tempted to go straight for the 1. What would you say to somebody?
I would say that 1 is probably brave. So I would say, for example, in this time, I would say definitely skip the 0.25 and go straight to 0.5, because even with 0.5, if you've never used retinol before, you will still peel. And it's not only the fact, obviously, like it looks a bit peely, but it's not the most comfortable either. So even though you're at home, you have to be careful, because one of the things you don't want to do is you don't want to pick off the peeling bits. So if you're at home, you may be more inclined to do that. So I think that a 0.5% is a sensible middle ground for the fact that you're at home, you can afford to peel a little bit, and then after a few months, you can then step it up to the 1%.
How much peeling is there? Because when we're putting makeup on the top, and how long until the peeling stops? So I'm thinking from my bride's point of view, they definitely don't want, and I definitely don't want to be working with skin that's, you know.
No, definitely not. No, you definitely don't want to be introducing something like retinol, you know, like 2 weeks before your wedding. It's something that you need to, I would say, at least 3 months before, to make sure that your skin has settled. I would say the 3 months before your wedding, you don't want to try anything new. So you start your regime, if you can, 6 months, even a year, even better. And then you have a chance to work your way up to introduce the retinol. And then by the time you get to 3 months, your skin will be used to it. So hopefully you're not expecting any peeling, because even makeup will not be able to really hide that peeling. But no, don't be put off from using retinol. You just want to make sure you do it in advance, so that you're not panicking, last minute with peeling.
I mean, and the other, I tell them, part of my advice before is don't even have any facials. I even say just even facials, because you just never know. At least within 2 weeks of your day, I would say don't use any facials. You just don't know how you may react. It could be you may never have reacted before. You might be getting this facial every month. Still leave 2 weeks before your big day before having any kind of treatment on your face, because you just don't know what reaction you might have, or how you might react on that day, especially with all the added levels of stress. Funny things, strange things just happen. I had one of my brides, who I'm particularly fond of, she had suddenly developed eczema on her the week of her wedding. It was all dry, and it was very much like eczema, and it wasn't just like a dry patch, and luckily we covered it, and it wasn't too but yeah, strange things happen. Don't do anything like too adventurous within 2 weeks of your wedding.
I think that's great advice. I definitely agree with that. And just make sure you keep hydrated. And it's difficult because a lot of the time you're eating a lot of sugar as well, which is really not good for your skin, and in the run up to the wedding. And it's difficult to obviously control everything. You want to enjoy the time as well. But just be careful, because you're gonna treasure the pictures forever. So you want to make sure your skin's looking as good as possible. I didn't really answer your question, sorry, about the scarring and pigmentation. So if the scars are not too deep, then you can definitely tackle it, and you can tackle the scarring and the pigmentation together. That's absolutely no problem, because the way that you're going to tackle it is going to be similar. They're both going to be with retinol, so you can do both together. The only time,
scars?
Yeah, it's not with the deep lumpy scars. It's definitely worth trying to see how much of a result you can get with skincare products, but realistically, you're not going to remove it alone with that. So you need to then look at having treatments, for example, like microneedling. I don't know if you've heard of microneedling. So what it does, lots of little needles into your skin, and essentially you're causing trauma to your skin. So your skin tries to repair, and the way that it repairs is by producing collagen, and that's going to really help to even out those scars. So, you know, a combination approach is sometimes needed. Sometimes it's also a bit of trial and error. If you've never tried anything before to tackle it, you know, we can start off slow, start with the skincare routine, add in active products. If we're not getting the result we desire, then we need to think about looking into more aggressive treatment.
With the microneedling, how many treatments do you need, and what kind of price point is it, or does that vary per
Yeah, so it definitely, the price point definitely varies, but I would say you're looking somewhere around, I think, about £150 to £200 for a session usually. But some clinics, if you're doing it together as a package, like, you know, they sometimes do deals. Realistically, if you've got quite severe acne scarring, you are going to need about 6 treatments, 4 to 6 treatments. So again, you need to start as early as possible. You know, you don't want to be having a treatment like that anywhere near your wedding. So you want to be doing it before and getting your skin to where you want it to be, I would say at minimum a month before. So then you're just maintaining after that.
So you could have one treatment maybe, and that would make a difference, or do you need to have continual treatment?
I think realistically,
products, they say about, you know, up to about 3 months to see a dramatic difference. Even though I feel like I've seen a dramatic difference already.
Yeah, so I think, you know, we need to be realistic. If the scars are deep enough that, you know, you're considering having a treatment and no products are working, then realistically, I would expect that the scarring is deep enough that you would need more than one treatment. Also, after you have the treatment, it doesn't work immediately. So it takes a period of a few weeks for your body to respond to it and produce the collagen and actually repair it. So you normally want to be leaving about 4 to 6 weeks in between your treatments as well. So it is definitely more of a long-term treatment plan.
Yeah, great, perfect. The next question was, one of my brides, this is actually for me, I made this question up. One of my brides had a long-standing acne problems, but she was actually allergic to the Roaccutane. Wasn't allergic to it, it was affecting her kidneys or something.
Okay.
So there was a reason why she couldn't have the Roaccutane, and that was the only thing that would work. So let's see. Would it still be safe to use medical grade skincare if you couldn't use the Roaccutane because of the effects on...
Yeah, so it should be fine because they work very differently. So the Roaccutane is actually a medication you're taking into your body, and your body has to break it down and get rid of it. Whereas with most of the topical things, they're going on your skin, they will penetrate, but it's not at a very high dose compared with the Roaccutane. So I would say most likely it should be fine. Again, like somebody like that who's had a reaction, I would definitely make sure we do, you know, a more thorough consultation, discuss all the medical history. But in my general consensus would be that it should be fine to use medical grade skincare. And it, you know, if the acne is bad enough that, you know, that she wanted to go on Roaccutane, because it does have side effects for everybody anyway, then it may be that we step up and we try a more aggressive routine to actually try and reduce reduce the acne as much as possible. I've come across a lot of people who've had great results with the Roaccutane, and then they come off it, and 3 months later it's back. Maybe not quite as bad as it was, but it's back. And the side effects are so awful that you think, is it worth it? So definitely try as much as you can. First, give the skincare a chance, because if that works, it's a much, much nicer way to deal with the problem.
That's an interesting point, actually, because I have had the same from my clients as well, that once they came off the Roaccutane, because obviously whenever I go to any client, one topic we talk about the most has got to be skin, because obviously that's what we're working on. And I often hear that very same thing, that once they came off the Roaccutane or something similar, it just came back. With the ZO products, and ZO are not the only ones that do sort of the medical grade retinol, there's Obagi and a few others.
Yeah.
If you come off, what happens? Does your skin stay as good as it had got to, or did it start regretting?
Well, it depends, right? So you have to think about what you're using it for. So for example, with pigmentation, if you've got it to a level where the pigmentation, let's say ideal scenario, the pigmentation is all gone, then as long as you're using protection to prevent more pigmentation, for example, with an SPF, being careful in the sun, then yes, it should kind of stay at that level. But with other things, for example, like acne, it's usually an internal thing that's causing continual oil production. So it's a little bit of a battle of outside versus inside. So with something like acne, realistically, you probably have to expect to need to do at least some maintenance long term. It may be that it was worse before and now you can scale it down, use less aggressive products, for example, but you probably will still need some maintenance. But to be honest, we should all be using, you know, a skincare routine all the time anyway. It shouldn't be, you know, just use it when you have a problem, because it's not about treating.
You could maybe go to maybe a non-medical grade, because some of the products
I wouldn't suggest that. Yeah, I personally wouldn't suggest that. So for example, like I'm quite a good example. Like I'm quite lucky. I generally have quite clear skin. I never really had spots or anything. But even then, I still use the medical grade skincare, but I just choose what I use. So, you know, I don't need to use extra oil control because I don't have a problem with oil control. But the problem I had, for example, was my skin was always a little bit dull, which you don't think is a problem. You know, you don't think that's a huge skin concern. But because I started using good skincare, my skin improved even more. So now I'm at a stage where it works so well. Why would I then want to go back to using, you know, basic products which we know don't penetrate through? So I think you'll want to stay on it.
As you shouldn't see the same fallback as the Bridal or that kind of medical, because it should have improved your skin to a degree that if you stop, it's not going to come back, is it? That scarring can't come back. But new scarring, possibly.
Yeah, exactly. And that's the thing, right? So for scarring, you know, it's not something that's going to be ongoing, unless, of course, you haven't controlled the breakout. So if you keep having new breakouts, then obviously you might get new scars forming. So initially, it's a stage of trying to stop new spots and trying to get rid of the old scarring. And then you're at a level where you're still just trying to keep the breakouts at a minimum, so that way you can prevent any new scarring, essentially.
Okay. Now, another one, like second to all of that, has got to be dark circles. Asian skin is particularly, and dark circles is such a huge issue. What do you recommend? What is the magic fix?
So with dark circles, it's a difficult one. I really wish I had an answer which will completely make it go away. But unfortunately, it is one of those things that is really difficult to tackle. The important thing, like we've mentioned with a few things, is trying to figure out why you have the dark circles to begin with. So for some people, you know, it could have been hereditary. They could have had it from a really young age. And in things like that, it's going to be really hard, you know, to actually tackle it. However, not all is lost. There are some products, for example, the Zedo range have a really good eye serum, and it contains retinol in it, and it also contains a derivative of kojic acid, which actually helps to slightly lighten the skin. So it's not going to be an overnight process, but over time, it will really help to reduce the appearance of that and also help with the light reflection. So it will help to reduce it, and then it will also help to make it look better than it is. So it kind of does both.
Yeah. Okay. What I would say is with some of my clients, sometimes I kind of break it down into two. Obviously, I'm not an expert like you, but I'd like to think I'm a kind of expert in what I do. And I would like, and I think, like you said, if it's hereditary, it's kind of like you're kind of a little bit stuck with it. Like you said, there is that under eye cream, which I never knew about, but sounds amazing. But if you are with a lot of the time, it can be just lifestyle. I must say, people are just going to bed way too late, spending way too much time on their phones, you know, not resting enough, not taking those breaks away from the screen, etc. And especially brides, it's the, you know, continuous planning and going to work in the morning and then coming and not going to bed till like 2, 3, and then putting on Netflix, you know. So you're not giving yourself that break. So, you know, lifestyle is so important to kind of rein it in and think, okay, you know, my big day is coming. I need to give it that due consideration. There's no point in spending hundreds and thousands on all the, you know, the cake and the venue and the singers and dancers and makeup artists, hairstylists. You have to do the basic things to look after yourself, and that is what's good. And ultimately, people are going to be looking at you. Although I am really, really good at covering your under eyes, so don't worry. We have got a question. Where can you buy the eye serum from?
So with this particular eye serum, which is a Zedo, you can only get Zedo products from a medical practitioner who has trained in those products. So for example, from me. So if it's something you are interested in, just drop me a message. All my contact details are on my profile, and we can arrange a consultation and sort of go from there. And there were a couple of questions earlier, actually, which I've just seen. So one of them was, what would you recommend for whiteheads? So going back, you know, the main thing is if you try to get your oil control really, really good so that you prevent the whiteheads is the main thing. But then I mentioned that ointment, which is benzoyl peroxide. So depending on how bad it is and how quickly you want it gone, you can use something like that. And also, Sophia mentioned those pads. They're also really good to help to, you know, just basically get rid of some of the oil, and it will help the whitehead to go down a bit quicker.
Going back to the eye serum, do you still need an eye cream if you are using all the other creams and skincare?
Yes, so the problem is
they don't.
Yeah, so the problem is that the under eye area is very, very sensitive. It's almost like a different type of skin compared to the rest of your face. So with most of the skin products, there's a limit to how close to the eye you can go without potentially causing irritation to your eyes. So that's why I would always recommend separately using an eye serum, because then you can get really, really close. You can also use it above, which a lot of people don't do. They just use it under their eye, but it's, you know, it's made to use on your eye. You know, you can use it in the brow here. You can even use it a little bit on the eyelid and underneath. So I definitely think you need both. And as I mentioned, they'll have specific ingredients in it which will make it really good at targeting, for example, like the dark circles. So definitely separate for sure.
Okay, guys, I'm really, really conscious we have less than 20 minutes left. So if you've got any other questions, quick, get them in, because we're trying.
And we have another question here.
Yeah.
And there was another question earlier as well, which says, can you recommend a moisturizer for combination skin? So yes, the Zedo honestly has the best moisturizer. It's called Daily Power Defense. And the thing with most moisturizers is when you put them on, oh yeah, you've got it, yeah. It's really, really nice. So with most moisturizers, what happens is you put it on your skin, and it sits on the surface of your skin. So what it does is it tricks your skin into thinking that it's basically moisturized. So it reduces your natural moisturizing things, which is hyaluronic acid. This one is made so that it literally goes through the layers of your skin all the way deep down to improve your own natural hydration of your skin by making more hyaluronic acid. So it will also be really beneficial for anti-aging, as well as helping with, you know, with dryness. So that's the one I definitely recommend. It's the best thing.
It's got these little speckles. It's white cream, and it's very light on your skin. And it's got little speckles of blue, which I found fascinating because I wasn't expecting that. So I thought, oh, it looks very clever. Okay, quick, let's go. Were there any other questions that I missed? I'm not doing very well with interacting with the audience.
No. I think that was it. I think that was it.
Was that it?
I think, have I frozen because I tried to look at the comments again?
Oh yeah, I think, yeah, you have. Do you want to come back out?
Yeah, I'll rejoin again quickly. I think I should stop looking at the comments because that seems to be when it happens. So let me just rejoin quickly.
Okay. Okay, guys, how are you enjoying it? Is there anything that we need to cover that we haven't covered yet? Hi guys, hi to everybody. So many of you. Oh, I need to turn you back round. Press something. There you go. Turned you around there for a minute. Right. Got quite a few questions to get through. Thank you, Saima. How are you? Hi, Simran. It's so nice to see you guys here. Right, she's back. Thank you for joining us.
Hopefully, okay, that's where. Okay, I'm not going to look at the comments, so I'll leave you in charge of it.
I will keep an eye on it. Syra Kanina says, hi, my eyes are a bit hooded. What products would you recommend? What procedure, sorry. What procedure would you recommend?
So hooded eyes is a little bit of a difficult one because it depends on the reason. So sometimes it can be due to excess skin, and sometimes it can be due to the lack of elasticity of the skin. So using an eye serum definitely will help, but depending on how hooded it is, that's probably not going to be enough. So definitely that's your first step. We always start with, the most conservative, less invasive approach. So start with that. We kind of want to use it in this area. That will help to tighten the skin a little bit. And then you will be looking at more sort of other treatments, for example, like Botox, which can really help to give you a brow lift. And that can actually help to reduce the appearance of the hooded eyes.
So your first step would be
the eye serum.
So, a serum. Okay,
yeah.
See if that tightens it. And then the Botox will lift it up. Not here though, just up here.
Yeah, so the way that Botox works is it relaxes muscles. So you would actually want to relax this muscle, which will help to bring this up, and then this muscle, which brings that up. So it's a little bit complicated, but it's always best to have a look. If I were to do an assessment and I saw that the eyes were particularly hooded, I would just be able to tell you, the eye serums aren't going to do much, so let's just skip straight to the treatments. So it's always best to just ask and do a consultation first.
You don't do any sort of surgical?
No, so I don't personally do surgical procedures, but yes, if it's the case where that's not enough and they are very hooded, there is another step in between surgical. There's also something which basically is a procedure that tightens the skin in that area. So you may have seen pictures of all these little dots potentially, and it's a procedure which tightens the skin. Otherwise, yes, you would be looking into a surgery, but obviously with surgery, there's a lot more risks. So again, you want to leave that as a last resort if you've kind of exhausted all your other safe options.
Okay, very quick one. If I'm using foundation if I'm using a foundation with SPF or a separate SPF, do I need to use a separate SPF as well? If I'm using the with SPF,
okay,
do I need a separate SPF?
Well, the short answer is yes. The longer answer is that the thing with SPF is it's not only about the number. The number is really important. So what the number tells you, it's quite interesting actually. So for example, if a product tells you that it's SPF 30, it means it will take 30 times longer for your skin to get burnt compared to not wearing an SPF at all. If it's a 50, it takes 50 times longer to burn your skin. So the number is associated with the burning of your skin. However, there are other UV rays. There's also infrared visible light. And those other things, they don't burn your skin, but they can cause pigmentation. They can cause aging. So you need to be using an SPF that protects against all of those. And if you have, for example, a makeup.
Yeah, like the light from your computer can cause aging. I was like,
it can.
I'm going to be 100 like next week.
Yeah, it can. And that's why you can actually get blue light filters. You can get blue light filters, which you can put on your laptop. Most phones just have a thing where you can put it on. So that's quite good. So definitely a separate SPF on top of your foundation.
But this is the Daily Sheer broadband, because Zedo do a few SPFs, don't they?
Yeah, they do.
Do we have to use 50 then?
I would say so, because what's the point? If you're going to use it, you might as well do the best protection you can. So you know you're gonna get like 1.5 times more protection from using a 50 than a 30. So I feel like it's a no-brainer. You should just go for the best you can.
What I did love about this one is it says daily sheer. I haven't tried the other one in the range. Like, this is the only one I've tried, but it is really light. Even I mean, I was thinking, of course, you know, there's like all these products to put on, and I don't like having lots of layers under my makeup because I feel like, gosh, I feel so heavy. But actually, it doesn't feel that way at all. It's like a really nice base, and then you've got your makeup on top, and it sits, as you can see, beautifully. Okay,
it's great. And the other good thing is that it doesn't give you that white ghosting effect. So the thing with SPFs is there's basically 2 types. There's physical and chemical sunscreens, and the physical sunscreens are the ones that, you know, we probably used to use more when we were children, or you do use on children. And on darker skin tones, it will leave you with that sort of ghosting white or almost purplish look. So you don't want that.
No, definitely do not want that. But what about you know, you get the SPF, you know, just a sun cream that you get, you know, like say from Superdrugs or whatever. Is that still okay? The factor 50 what's the difference between those and these sort of high-end ones?
So what you'll find is on the bottles, it will tell you what it protects against. So in general, with the mainstream brands, you'll see that it protects against UVA and UVB, but they won't have protection against visible light, and they won't have protection against infrared. So those are the ones that are the silent killers that are going to cause aging. So if you really, really want to protect your skin the best you can, it's best to use one that has all 4 of those. For example, the ZO one is a really good example. There's also a range which I love for all sun protection. It's called Helio Care, and it's really, really nice. They've got a lot of sort of more tinted SPF, tinted moisturizers. They've even got one which is almost like a foundation. It's not doesn't give you as much coverage as a full foundation. Yes, almost like that, but it comes in a little pad, like, you know, like in a little vanity thing, and it's got a sponge. So it does feel quite like a foundation, and it has all the protection. It's SPF 50. So for example, that's what I use most days, you know, like when I'm just going to work, because I don't want anything too heavy. Yeah. So that's quite good.
A lot of my clients, that is what they like. They like a really light coverage. And you know, a lot of my brides do just want to have like a very natural look. So that is really great to know. I want to just pick some ones out. Okay. Pre-wedding routine. How long before the wedding should you start doing facials? We covered that, didn't we? We said about at least.
Yeah, so you want to not do anything new, I would say, if you can, a month before. So figure out exactly what works for your skin, and then don't change it. Okay. So a month before, don't add anything, take anything away, keep it the same as much as possible.
If you were to start, something new, no later than 3 months before your wedding, maybe?
Ideally. I mean, the thing is, it depends on yours. If you're going to start a whole new skincare routine, definitely start at least 3 months. If you're already using a skincare routine, for example, like Zedo, and you want to add in 1 more product, if you did that like 2 months before, you're probably going to be fine, because we would know, like I would know by then how your skin is, how it reacts. So they always keep in touch to see, you know, the progress. So yeah, we should be fine, but don't do anything drastic on your own. Just check with me first.
Yeah. To have barely wear makeup where your skin looks like actual skin and not caked on, do you need to have really flawless skin? No. Is the answer.
Well, this will be interesting. So what I found, actually, so I was actually due to get married this year, but now it's been postponed to next year. And usually I don't wear a lot of makeup. So when I went for my makeup trials, I was like, oh my God, and I was probably that annoying client. I want it to look really natural. I don't want it to look like I'm wearing a lot of makeup. And it's exactly right. If you have a good makeup artist, they put a lot on, but it doesn't look like you're wearing a lot. You know, so it just has the.
In fact, a lot of people do say, oh, you've got 7 minutes. A lot of people do say, oh, you know, I don't want to be, you know, I want a really natural look. No, that's too much. They get scared, especially if they've had previous experiences which have gone horribly wrong, which is often the case. You know, your makeup artist can scar you for life. Pick wisely, ladies. And what I would say is it's actually harder to do a natural look than to do a full face, like this, you know, it's visible, because the amount of blending, and you know, it does even sometimes take longer than really kind of placing the product and blending, because you just want, you have to get it absolutely right to the, it looks like to be wearing products and look like you're not wearing product. I mean, that's just magic, isn't it? But it can
definitely
be done.
It can be done, but I do think, as you know, as you mentioned before, if your skin is as smooth as possible, as hydrated as possible, the makeup is just going to look better. So as much as you can
make our jobs easy, ladies. You know, look
exactly,
after yourself, and then it just is that much better. And so many times, you know, the second time around after the bridal trial, when I go around, sometimes it's 6 months, sometimes it's a year, sometimes it can just be a few weeks later. You know, every tiny little bit, even just adding in drinking water every day makes such a big difference. Another good thing that I say to my clients that really works is aloe vera gel, just every night. And it really is something that's inexpensive, but it does boost quite a lot. Okay, let's see what else is there. What's the best way to match up your foundation when you do the bridal trials? And what if on the actual day the bride has changed colour slightly? That has happened to me. I had a bride who had her trial and she was one colour, and then when it came to her actual wedding day, the good thing was she had a trial in between. When it came to her wedding day, she had been on holiday. So the colour for her trial and the colour she was on her wedding day, she was like a totally different person. She was at least, I would say, a good 7 or 8 shades lighter, but it's fine, because a good makeup artist is going to have, you know, is going to be totally prepared and have every single color ready in her kit, like me. So it's not going to phase us at all. You know, we will match you whatever color you are or want to be. Sometimes people, you know, are really, really fair and they want to look more golden, more bronzed, and other times it's the other way, you know, the darker
skin definitely
fairer.
Absolutely.
Personally do anyway. Bridal makeup skincare is different to party makeup skincare, and I think we're going to have to do that on another video, because on another chapter, we've got 4 minutes left. What's the best way for a bride to avoid tired, puffy eyes in the morning? Have you got an answer?
So I would say drinking water, especially before bed, is really important. The other thing that can actually help is sleeping slightly elevated. So basically what happens is when you lie down overnight, all the water basically goes to your face. And if you have quite poor lymphatic drainage, you can end up having puffy eyes. So if you literally prop yourself up on a few pillows, you will notice a difference. So, you know, in the run up to if you want to do that every day, if you never want puffy eyes, obviously even better. But if you're very concerned, especially coming up to the wedding, if you know you're not going to be sleeping properly, stay hydrated and then prop yourself up when you sleep.
Yeah, fabulous. And then, you know, we have products in our kit as well to just calm everything down. And, you know, like I said, with eye creams and stuff as well, it does reduce puffiness sometimes as well. So, you know, any last minute fixes, you know, I will always have something in my kit to, you know, as a last minute magic fix. But skincare, ladies, is so important. We have just got 1 minute left. Farrah, I'd like to thank you so much for joining me for my the first in the series for my bridal IGTV series. So thank you so much for kicking it off in such a spectacular way. You've been so informative. So thank you.
Thank you. Thank you so much for having me. It was a lot of fun, and I hope that was useful for everybody. Thank you so much.
I learned loads. So we will catch up so we can ask you some more questions about my routine. And guys, thank you for joining us. And if you stayed with us this long, I really, really appreciate it. And I am going to save this on my IGTV so you guys can catch up if you had to go and miss or anything. Okay, thank you. Bye.
Bye. Take care.